In the interest of creating new medical knowledge through the efforts of the scientists of the Oklahoma Medical Research Foundation for the benefit of all mankind, regardless of age, creed, or color, I join with all others in the business and professional fields in lending my aid.
When my wheat is harvested, I will deliver 200 bushels to a public grain elevator for the account of the Oklahoma Medical Research Foundation.
450 wheat farmers from 34 Oklahoma counties. People of modest means, families who coaxed their living from Oklahoma's cracked red soil.
Now, this grain of wheat reminds me of the endeavor of all of us who grow wheat to provide for this year's harvest, but to give as many bushels as we possibly can for the Oklahoma Medical Research Foundation.
They gave by plowing, sowing, watering, harvesting, threshing. In a single year, they dedicated 9,000 bushels of wheat to OMRF, all to cultivate a dream of healthier tomorrows, a dream that took shape as World War II came to a close. That dream began with a group of Oklahoma physicians. They were practitioners, people who spent their lives battling sickness and disease on the front lines. But as they fought day after day to repel the same scourges, tuberculosis, heart disease, cancer, they came to understand that it was not enough simply to treat the sick. To make real headway against disease, medicine had to do more. So in 1946, those visionaries founded an institute where scientists could devote their entire careers to rooting out the causes of human disease, the Oklahoma Medical Research Foundation. The next step was to transform the idea into concrete and steel. Governor Roy J. Turner led a fund drive that spanned all 77 of Oklahoma's counties, and the gifts came, large and small.
Our son, during his life, wrote with a lavish hand, and in 24 short years, the pages of his book of life were filled. Since his passing, Mr. Marlowe and I have wanted to do something that would be a memorial to his memory, something symbolic of his life, something that could and would live on long after we were forgotten. If through our small contribution we can help in saving one life, keep one mother's heart from breaking, we will be grateful. This is one of the finest things we of Oklahoma have ever attempted. Such a wonderful movement cannot fail.
Oklahoma native Sherman Billingsley, owner of New York's famous Stork Club, secured a $25,000 gift. OMRF even received part of the proceeds from the Audie Murphy movie Bad Boys. All told, 7,000 people gave more than $2 million. On July 4, 1949, Sir Alexander Fleming, the man who discovered penicillin, dedicated the plot of land that would be home to OMRF.
I watched them build this building. Lord, I said, send me somewhere that I can keep my temper. And he sent me here. My first day of work was September 16, 1952, in the research hospital. I brought the patients their meals from University Hospital on a cart through the tunnel under 13th Street. I sure did love those patients.
OMRF's doctors and nurses took care of the sick. And in their new labs, scientists explored the mysteries of heart disease, cancer, arthritis. They published nearly 100 papers in the Foundation's first half-dozen years of existence. They secured funding from the country's leading granting agencies, the National Institutes of Health, the American Heart Association, the National Cancer Institute. Sports heroes like Bud Wilkinson, Jim Lookabaugh, and Sugar Ray Robinson pitched in to help OMRF. So did legendary oilmen like Jim Chapman, J.G. Puterbaugh, Bill Payne, Ward Merrick, Robert S. Kerr, and Dean McGee. But without the generosity of ordinary Oklahomans, the young foundation could not have survived. There were the OMRF lamplighters, teens who logged thousands of hours going door to door to collect donations. Formation research, students who raised more than $50,000 by passing coin buckets at football games. the Oklahoma Association of Mothers Clubs, the Volunteer Women's Service Corps. Everyone did what they could to fight human disease.
The advanced typing class has completed typing the envelopes for the Oklahoma Medical Research Foundation. We took a total of 135 man-hours to type the envelopes and 42 man-hours to stuff and pack the envelopes. The quality of the work on these envelopes was excellent.
OMRF is more than a medical research foundation. It is Oklahoma's Medical Research Foundation. Thanks to the hard work and generosity of hundreds of thousands of Oklahomans, OMRF has become one of the nation's leading independent medical research institutes. It is now home to more than 500 staff members, including some of the world's foremost immunologists and cardiovascular biologists. And like the once barren lands of Oklahoma, OMRF's labs have yielded unimaginable fruits. Our scientists have given the world a revolutionary drug to treat children suffering from a life-threatening blood clotting disorder, a powerful test to predict the risk of developing breast cancer, an experimental drug to stop Alzheimer's in its tracks, and Zygris, the first treatment for a deadly blood infection that claims 500,000 lives each year.
I was on my way to heaven when they gave me Zygris. If we didn't have breakthroughs like those being developed at OMRF, we wouldn't have miracle drugs like Zygris. And without it, I wouldn't be here. You're saving lives.
Maybe it's the sweeping plains, or the faith that grows from overcoming stiff challenges. Because when it comes to medical research, Oklahomans have always had remarkable vision. They have always seen the possibilities the future holds. OMRF. A cure is out there.